Welcome to the Aesthetics and Wellness podcast by Dr Yusra. On today's episode, we are talking all about hair loss. Now, this is really trending in social media at the moment, and we have come on here to help you so that you are not falling for marketing ploys, but actually that you are the educated consumer, that you know what types of hair loss there are and what type of treatments there are and how to start and where to start. I hope you enjoy. Hi, everyone. Welcome to today's episode. Today, I have Sophie Wilson with me. Welcome, Sophie, again.
Hello.
And today we're talking about hair loss, which is a concern that we see a lot in clinic and treat. A lot of patients who are concerned with hair loss, patients of all ages, men, women. And I think although it's not a life-threatening illness, it's a really distressing condition. So I know you've come with a whole bunch of questions, Sophie, so hit me. How can I help?
Okay, so thank you for having me again.
My pleasure. Thank you for coming.
Not a problem. So I suppose the first question that we maybe get is patients don't know what's causing the hair loss. So what are the main causes of hair loss?
So there can be a huge number of different reasons why people are losing hair. And some of this can be because of an inflammatory condition, so something going on with the scalp. And I think people often forget to look at their scalp with love and care. And what a lot of people don't kind of realize is that the skin on the scalp is a continuation of the skin on the face. And we wash our face, we exfoliate our face, we put SPF on our face, and then we don't really treat our scalp with love and attention that it needs. And we use shampoos with lots of sulfates in them. And people are often oiling their hair and overstyling their hair, and their scalp can start to become congested or unhealthy. And if you have an unhealthy scalp, then you will have unhealthy hair. So I always say start with the basics. And when it comes down to hair loss, we got to look at the foundation, and the foundation is the scalp. And if the scalp is unhealthy, you might have irritation, dermatitis, inflammation in the scalp, then you're almost certainly going to have some extensive hair loss. Now that's scalp related, and there's two different categories of hair loss. One is a scarring type of hair loss and one is non-scarring. And when we talk about scarring hair loss, this is probably the severest form, where the follicle, and you have this little opening, we call it an orifice, and the follicle or the follicular orifice can close up and it can become non-existent anymore, can scar and close up. And if we as medical professionals are looking at a patient's scalp and we can't see the follicles and it becomes a shiny, smooth scalp, then that is scarring alopecia. Alopecia means hair loss. So if you have scarring alopecia, then you need to go and see a dermatologist. And treatments are deemed ineffective, and you may need a surgical hair transplant or other steroid injections or other treatments. So let's talk about non-scarring alopecias, because non-scarring alopecias often happen before scarring alopecia. Non-scarring alopecias or non-scarring hair loss can progress into scarring. So when you start to lose hair, remember this follicular orifice or this opening, the opening of the follicle. It is so important that follicle remains open.
Yeah.
And if it closes off, then it closes off treatment options as well.
Okay.
So we want to treat patients while their follicle's still open, because over time, with more and more inflammation or more and more scalp disease or hair that continues to thin and thin and thin, the orifice becomes smaller and smaller and smaller until the hair doesn't grow out of it anymore. And then it becomes really difficult to manage.
So it's the sooner the better. If you notice it, you need to do something about it, really.
100%. And of course, there are a few things that are normal, like, for example, pregnancy. In pregnancy, post-pregnancy, women do tend to lose hair a few months after pregnancy because of the hormonal shift. Now, again, there's different types of hair loss. And it's important when we're talking about hair loss to understand first the pathology and what's normal.
Yeah.
Okay. It's normal to have some hair loss.
Yeah.
On a daily basis. We're shedding our skin, we're exfoliating our skin, our scalp will exfoliate, and our hair will exfoliate. So there are 3 phases of hair.
Yeah.
And at any one time, 90% of your hair is growing or should be growing, and that's called anagen. The phase in the hair cycle, the anagen phase is the hair growth phase.
Okay.
And then you have catagen and you have telogen. And telogen is when you are shedding hair. Most hair shedding happens during telogen. And usually that's a maximum of 5 to 10% of your hair.
Okay.
If you suddenly start to notice lots of hair coming out in the shower, or clumps of it coming out when you're brushing your hair, that is something that we would usually start to consider a disorder called telogen effluvium, when you've got lots and lots of hair loss. And that the triggers of that can be emotional stress. And we know stress, cortisol causes literally wreaks havoc on the body. And it will also cause hair loss, or it has the potential to cause hair loss. And usually a patient that's going through telogen effluvium, so suddenly they're losing clumps of hair, will have some kind of emotional trigger 2 to 5 months before the hair loss starts. Now, it can be self-limiting. It can go away on its own. And it can be a normal physiological process like post-pregnancy. Pretty much every woman post-pregnancy will start to lose hair because of the dips in her hormones, progesterone, which she no longer needs to hold on to because she's delivered the baby. So the hair starts to shed. And it's the hair that she would have shed anyway during pregnancy that she retains during pregnancy. It's self-limiting. It usually starts 2 to 3 months after pregnancy and usually finishes by about 9 months after pregnancy, at which point she'll have little baby hairs growing.
Is that what it is? The sort of little fringe that can appear.
Fringe, and hands up, I've got this little fringe. I've got my little baby hairs coming because I've had a baby as well. I've had 3 babies, so I've been through it, and I now no longer panic when that happens. Otherwise, it can be, like I said, it's not a life-limiting concern or issue, but it certainly can impact patients' quality of life and self-esteem by, for sure. Our hair, men and women, but particularly women, it's hard to hide, isn't it? And it's part of your identity, it's part of your femininity. So when you start to lose hair, it's really, really scary. So telogen effluvium is one of them, and one of the most common ones. And then you'll have heard of androgenetic alopecia. And that's exceptionally common as well. And that happens in men and it happens in women. Okay. Now, androgenetic alopecia tends to be age-related and hormonal-related. And as we know, when we are aging, our hormones will shift, not just women, men too. So when we're aging, women in particular, they start to lose estrogen, they start to lose progesterone, and they start to lose testosterone, which is a female hormone too. But as we're losing estrogen, which helps it keep our hair, we also are more likely to start to notice hair thinning. And we call that also female pattern baldness. So what happens is the hairline at the front is kept, but on the crown of the head, the hair starts to thin. And again, that can be really distressing because women are, coming in often and saying, my hair is like so much thinner. It's not as thick as it used to be. I'm worried I'm going to go bald. And we do know that in some cases, androgenetic alopecia can continue to proceed until there is complete baldness. It is more common to get complete baldness in men than it is in women. Women can have severe hair thinning. But in men, it's a really big concern as well. And in men, it tends to start a little bit sooner. Now, men also lose testosterone as they're aging. And we know that by the age of 30% of men will undergo some level of hair loss. By the age of 40% of men will undergo some level of hair loss. By the age of 50% of men will undergo some level of hair loss. So this is not sex specific. This is men and women. And it's important to understand what's normal and what's not normal and what you can do about it. So those are the kind of the main categories. Stress will always have an impact. Pregnancy may have an impact. Hormonal shifts, age-related, and then diseases. There are psychiatric conditions where you can lose hair, and there's one called trichotillomania, which is where people deliberately are pulling out their hair. And over time, that can result in scarring alopecia. That's a psychiatric diagnosis and would require psychiatric intervention. But generally speaking, these are the non-scarring alopecias. There is another one called alopecia areata, which I'm seeing more and more in clinic. And this is where you have patches of discrete areas of hair loss. I think you've seen one of our patients with a picture of that recently. And this needs to be treated usually with steroid injections. So it's important to get the diagnosis right because not all hair loss will be treated the same. So diagnosis must come first.
I suppose it's the same with your skin. Not everyone's acne necessarily is caused by the same thing. It could be hormone, it could be food related. So it's about making sure we're treating the skin and the scalp as their own entity, I suppose, as well. Although they're a continuation, there are different causes for different things.
And not all types of hair loss will be treated the same.
No, definitely. So what type of treatments can help with hair loss?
Great question. So, I mean, going back to diagnosis, I think the first thing that I do, because we often get patients who call in and say, can you treat me I've got hair thinning, I've got hair loss, can you treat me? And we say, you need to come in for a consultation. And there's a reason why we say that, because it would be negligent for us to just, bog standard say that a treatment is going to work on all patients. That is not the reality. And also, we're duty bound to provide a treatment that we feel will be of benefit. If you've got scarring alopecia, for example, it's not appropriate to have treatment. In primary care, you need to go and see a dermatologist. Yeah. So if you've got shiny scalp, you can't see the follicles anymore, there's literally no hair coming out of that area, then that's an issue that needs prompt treatment. If you've got diffuse hair loss or diffuse hair thinning, you're noticing clumps of hair coming out, anything like the male androgenetic alopecia, female pattern baldness, male pattern baldness, then absolutely we can help. Yeah. But I would always say start off with coming in to see us for a consult, and we will tell you if there's something that we can help you with. And I would also recommend a test. And this test is one that we do in both clinics, London and Liverpool. We've been doing it for years now. Yeah. And it's a really valuable tool in our toolkit. And I'll tell you why. The British Association of Dermatology and the American Association of Dermatology actually only recommend formally one treatment, which is minoxidil, also known as Rogaine or Regaine. Okay. And this is a medicament. It's a topical solution that you can apply to your scalp. Okay. And what it does is it stops telogen, which means it stops hair loss. Okay. So it's not going to promote new hair growth. Remember we said that there's different phases, right? There's hair growth anagen, and then there's hair loss telogen. You might have, the reason why you're losing hair might be because of anagen effluvium. You might have an issue with hair growth. You might be losing hair or noticing hair thinning because you're not growing hair. Or you might be noticing hair thinning because you're losing too much hair. Yeah. And the treatments will differ. Minoxidil is the only medicament that the dermatologists are advised to advise our patients to use. Now, here's a problem with that. Although it can certainly help, and it can help with stopping hair loss and hair shedding, and it's very effective, it's only effective in 60% of patients. And in fact, in 40% of patients, we know that it can make hair loss worse. And that is dependent on their genetic predisposition. And I have had so many patients who come and say, I've been prescribed minoxidil by my GP, and it's made my hair loss worse. And that's not the GP's fault. That is because they are genetically predisposed. Now, we know that not all medication is going to work on our patients. We know that I could give patients paracetamol and it would work amazing in one patient and not so amazing in the next patient, right? No doctor on planet Earth can guarantee that every single treatment is going to work for every single patient. It just doesn't work like that. That's not healthcare. It is a little bit of trial and error sometimes. And when it comes to hair loss, you can't afford that trial and error. No. You can't afford in a patient who's already got hair loss to potentially make their hair loss worse, which is why I strongly recommend the Tricho test. The Tricho test is essentially a test that is a genetic test and involves a number of different parameters. We would essentially take a piece of your DNA via a sample of your saliva, send it off to a lab, and they will check genetically if you are predisposed to losing hair, and also what treatments will work and what treatments would absolutely not work. Yeah. So it's such a worthwhile investment for £200 instead of spending thousands of pounds on a treatment that could potentially make your hair loss worse or do nothing for you. At least now you know, and information is power. And that's what the Tricho test affords to us. Yeah. There's also a part of that where we do the hair pull test. And basically what the hair pull test is that we grab about 40 to 60 hairs and you apply it between your thumb, your index finger and your middle finger, and you apply gentle traction or pressure. And if you are losing more than 10%, so 4 to 6 hairs, then that is deemed to be telogen effluvium. Your hair should be grounded and well rooted in the root. Yeah. If it easily comes off through a little bit of gentle traction, like brushing your hair or gentle pull, then there is an issue. Okay. The root is not strong enough, and that is we would diagnose then telogen effluvium. Now, you asked me about treatments. So first off, I would strongly recommend the Tricho test to my patients. Yeah. Secondly, I would look at their scalp. If they have congestion on their scalp, or if they have dermatitis, if they have inflammation on their scalp, I want to cleanse that scalp deeply. I want to get that scalp back to health. Because if your scalp is not healthy, your hair isn't going to be healthy. It is as simple as that.
Same as your face. If you're trying to treat acne or pigmentation, you cleanse your face first. You don't just keep applying whatever's been recommended otherwise.
Perfect example. Exactly. And so like we always say to our patients, double cleanse at night, right? It's the same with the scalp. The scalp gets congested. And if you have inflammation in the scalp, you've got dermatitis, you've got flakes, we really need to get that scalp healthy.
Yeah.
There's no point working backwards. You've got to treat the source of the problem. If you go to your GP and you've got a rash and they just give you a cream for the rash and not look at why you've got that rash and treat the symptom, treat the source rather than the symptom, it's just going to keep coming back.
Yeah.
So we want to get the scalp nice and healthy. And we do a treatment in clinic, which involves steaming the scalp, deep cleansing the scalp, exfoliating the scalp, and then infusing it with peptides. Think of it like a mask for the scalp or a deep exfoliation for the scalp. And that's called the Hydrofacial Care Revive. It's a really satisfying treatment to have. I've had it done.
Have you had it done? I think on my very first day, they needed a model. So there I was having a Hydrofacial Care Revive. So yeah, I've had one.
And it's shocking, isn't it? It's shocking because we have had hydrofacial in our clinic for years. It's a nice treatment. I wouldn't say it's groundbreaking, but for the scalp, it really is a unique treatment. And the amount of gunk that you see come out in your scalp that you just washed this morning and you think is like nice and awesome and clean is shocking. We see lots of froth, we see lots of debris, we see lots of dandruff, we see lots of flakes. And then we give the patients a peptide solution to apply to their scalp. Now, for those patients who don't know what peptides are short chains of proteins, like amino acids. Remember, your skin is made out of collagen. Largely, it's the most abundant protein in your body, and 90% of the collagen in your body, 90% is collagen type 1, and that's a protein. Okay, and proteins are very important for health. Collagen is not just there to help you look good or for structural integrity. It's actually there for wound healing. And peptides have been shown to have very similar properties, even on the skin or the face, to retinoids. They help with anti-aging. They help with wound healing. They help with cellular repair. They help with anti-aging. So we know that actually peptides on the scalp can really, really help with hair growth and improving the skin of the scalp. So now we've deep cleansed the scalp. We've stimulated it. And we've infused the scalp with peptides. And that's like my groundwork. It's like that when we are infusing the scalp with peptides, it's like fertilizing the soil or the scalp. And that gives us our baseline, our canvas. Following on from which, we have a number of different treatments that can work. Now, again, our patients' journeys, the hair loss journey is fully encompassing everything. Their diet, their lifestyle, their bloods, are they low? Are they deficient on vitamin D? Are they deficient on iron? Are they deficient on vitamin B12? I'm going to talk to you about vitamin B12. I'm going to talk to you about vitamin B and biotin because there's a lot of nonsense out there. And I think patients are buying all these gummies that do nothing. But we really do need to look at it holistically because if you've got inflammation anywhere in your body, it's going to come out on the outside. So we need to make sure we're resetting everything and really ensuring that the patient's diet is optimized, their health is optimized, and what they're placing on their scalp is also healthy and optimizing their scalp health. It's like when patients are coming to me with acne and I say, well, we need this cleanser and we don't put this makeup on your face, use this makeup instead. Everything that you put on your scalp is going to make a difference. So there are specific shampoos for specific concerns. And I sometimes will give my patients shampoos with prostaglandins because prostaglandins have been shown to improve hair growth. Okay. I will sometimes give my patients shampoos with caffeine because caffeine helps to improve blood flow to the area. I will sometimes give my patients shampoos with rosemary because we know that rosemary can improve hair growth. So shampoos and conditioners are an important part of the hair treatment journey. And it's important that they're using the right shampoos and the right conditioners. And that might be Grow Me, it might be Niacin shampoo, it might be Revitalash shampoo, it might be Viviscal. There's a whole range of different products. And it's not one size fits all, like in the same way. It's not one cleanser that fits all for the face. Depends on the patient. And then in terms of treatments, there's a number of different treatments that patients can have. And I'm going to talk to you about the non-surgical treatments and the surgical treatments. So non-surgically, we can start to improve the production of hair, depending on the reason why the patient is losing hair. Now, minoxidil, which is probably the most popular treatment, or Rogaine, the most popular treatment out there, like I said, is very effective, but only in 60% of patients. And if you stop minoxidil, you lose all the hair. So in a woman of childbearing age who's thinking about having babies, it's not a good idea to be on it because you may have to stop it and you lose all that hair and you go through that. It will restart and it'll be very distressing. In males, sometimes it's easier. Males, like I said, can start losing hair quite young at 30s, and it will be a lot more obvious because they tend to lose hair from the hairline. Their literal hairline starts to recede.
My other half, bless him, he is starting to lose
hair.
his hair. Yeah, definitely.
And what is it that you can see?
It's almost here to here.
They get like a McDonald's sign.
Yes, and it's thinning a lot on the top.
Yeah.
And it's going there. He does wear a hat a lot.
To hide it?
I don't know, to hide it. He's always worn a hat. So I'm like, take the hat off. Because I do think just...
Yeah.
So yeah, but he is, unfortunately.
Bless him. It's common.
Yeah.
And with men, like I said, they will get, their hairline starts to recede. And it will recede at the temple. So they'll start to find that their forehead looks longer and longer and longer. And their hairline is moving further back. And they can get scarring alopecia quite quickly. So the follicles can close off. So I would say get treatment sooner rather than later. Bring him in and we'll treat him. And I think it's, there's no taboo, there's no stigma associated with it. And I think it's important for our patients to understand that. And for some patients, they decide to go and have surgical transplants or hair transplants, which is absolutely fine. But remember that hair transplant, you can also lose it as well in future, right? So, surgical hair transplants are an option for men and for women. It is not always feasible. Not everybody wants to go through the trauma of surgery. Not everybody can afford surgery. And sometimes people want to prevent hair loss and maintain what they have and try the non-surgical options. And I'm certainly doing that for myself. So non-surgically, what we can do is topical medicaments like minoxidil in certain patients, sometimes oral medicaments. And one of the oral medication that we can give to our patients is called finasteride. Now, of course, this is on prescription. Please don't go and try and order this online at home. These are prescribed by a medical professional. Most of our patients will be booked in with our pharmacist prescriber who will go through the tricho test with them in detail and then look and decide what treatments are best and prescribe the right medicament. Often, and a lot of our patients are on topical dutasteride. And I think this is really underused. People don't really understand it much. Finasteride is a medication that can be taken by men or women. And the thing is, it does help to improve hair growth and prevent hair loss. But there are side effects. And the side effects can really impact the quality of life, including loss of libido. And also erectile dysfunction. And also gynecomastia, which is an enlargement of the breast tissue. So for many men, that's not going to be on the table. They can, however, have the solution of dutasteride on the scalp. And sometimes we will, because we make our own solutions, we prescribe what's called compounding. We work with the pharmacy that can actually combine and bespoke the right solution for the right patient, which means you're not buying the off-the-shelf Rogaine that might work for you or might not, but actually it's been specifically designed for your hair loss, for your genetic predisposition, and it is much more likely to make a huge impact. And we know that it does because we've got so many happy patients. And these solutions you apply onto the scalp, usually in the evening, and then you can wash it off in the morning. And it helps to both improve hair growth and reduce hair loss. So you get this combination approach. So that's your do it at home, your shampoo, your conditioner, and the solutions that we would prescribe to you, or the oral medicaments where appropriate. What about in-clinic treatments? So we talked about the scalp, deep cleanse, the Keravive, which I love. Now we can talk injectables. Now, when it comes to injectables, what are we trying to do? We are trying to stimulate that hair follicle. It all comes down to the hair follicle, because that hair follicle can get tighter and tighter, but it can also get lazy, right? And so peptides are very important, and so are growth factors. So growth factors are specific, again, amino acids or stem cells that when injected into the scalp, wake up or stimulate the dormant follicles and the fibroblasts on the scalp. And that means that the follicles that maybe were not functioning properly, or maybe kind of getting lazy, maybe aging a little bit, not functioning at its optimal health, starts to wake up and lay down new hair. Okay, so you're waking them up. And for hair growth, you can get them injected every 2 weeks, and most patients need 6 sessions minimum. And you see a great difference. Now, there is another treatment called PRP, which some patients prefer. PRP is platelet-rich plasma. And platelet-rich plasma is basically, essentially, where we take your blood, we put it through a centrifuge, we spin it, we separate the plasma, and we separate the red blood cells, and we take the plasma, which is full of we call it platelet-rich plasma.
Yeah.
It's full of platelets and growth factors. And we inject that back into your scalp. And because it's got growth factors and it's autologous, which means it comes from you, there's no risks, very low risk treatment. And it will, again, wake up the hair follicles and start to stimulate hair growth. A fantastic treatment. However, there is a variability in predictability because it depends on the health of the patient.
Yes.
If they are stressed, they're on drugs, they're smokers, they're not well hydrated, they're not living a good lifestyle, they're not eating healthy, their bloods, their platelet-rich plasma isn't going to have the same degree of efficacy as maybe a patient who is sleeping really well, not smoking, really well hydrated, eating their 30 fruit and veg a week. Naturally, there's going to be a degree of variability. So I do PRP in my patients who I know have a healthy lifestyle and who will follow my protocol of 2 weeks before. You really need to up your vitamins, ensure that you're well hydrated, sleep really well, do all the right things. So that when you come in to have your PRP treatment, you're getting more bang for your buck. Your cells are healthy, right? That's a really important point. And if you think that you're not going to fit into that category, then I would advise growth factor injections instead. Or polynucleotides. Now, there's, by the way, a huge amount of positive research in PRP. We know clinically, scientifically, it's proven to work and it's proven to be very effective. But have you heard of polynucleotides?
I have.
Okay.
I have. It's a very popular, I'd say, treatment in clinic lately. A lot of our patients are having it, are really interested in its benefits. So yeah, definitely. It's
kind of been all over the news.
Yeah.
As if it's a new thing. This is the interesting thing about the aesthetic medicine field is that actually polynucleotides have been around for a long time. In fact, decades, right? But it's fads and trends and it's the popular thing to do at the moment. And it's fantastic. It has a huge amount of clinical data behind it. In fact, polynucleotides have done a whole podcast just on polynucleotides. Polynucleotides have been in the medical field for decades, 70 years. And they have been used in wound healing, burns, infections to help to stimulate wound repair. And they've been used in aesthetic medicine for maybe the past decade. And of course, in the UK, we're a little bit slower to bring things on. They've been around for a couple of years here in the UK, but really taken off over the last, I would say, probably 18 months to 24 months. Now, polynucleotides are technically strands of DNA that are extracted from fish sperm or the gonads of fish. Really exotic. And they are not all made equal. Some polynucleotides come from wild salmon that maybe are a little bit stressed, are being chased by other bigger fish, have ingested not very healthy food, have been exposed to pollution in the water. And so that's called wild salmon. We don't really know. We can't control the lifespan and the variability of factors surrounding the health of that fish. And then there's farmed fish, which are that all of the variables are controlled, which in theory means that the polynucleotides extracted from that fish sperm is going to be more consistent. Because all of the fish have had the same life cycle compared to the one wild salmon who's having the time of his life and the other wild salmon who's maybe super stressed. And same with PRP. It's the exact same concept with PRP. If you're healthy, your PRP is going to be healthier. If you're not so healthy, maybe not so much, right? So there's going to be a degree of variability, and that removing those variables means better consistency. So the one that I use in my clinic is from farmed fish that are not farmed specifically for taking their gonads or their sperm to make people look younger. But actually it's used for nutrition, but the leftover, the gonads are then taken and the DNA is extracted. And then there's a difference between long chain polynucleotides, think of it like a necklace, or short chains, And the short chains are more effective. The body recognizes it much quicker. Like a scanning your barcode. Your body recognizes it. And when it recognizes it, when you inject it into the skin, the body recognizes it because the strands of DNA in fish are very similar to human beings. And then we start to lay down new collagen. And in the skin, it helps to promote fibroblasts, which lay down new collagen. In the scalp, it helps to lay down more hair. So you start to get more hair growth. So it's a very effective treatment. You can use it not just in the scalp, but also in the eyebrows. And it's indicated for that. And again, the ones that I use are highly purified. So it doesn't have excipients. I think it's important because not all polynucleotides will be the same. There are products out there like Lumi Eyes, which are Korean, that have excipients. that don't have the same regulatory backing or testing than the highly purified ones that have a huge degree of testing in clinic. And I think it's really important that patients understand they're not all the same and know what they're getting and what they're paying for. Polynucleotides have a huge amount of clinical data behind them.
Okay.
For generalized wound repair, skin healing, hair growth, etc. So that's a really, really promising area of hair loss treatments that I think have been slightly under researched. There's scope for further research. We know that PRP works. We know the variability. We know the issues with it, and we know how well it works. And therefore, when you know what works in which patients, you can then tailor your treatment plan and select the right patient for the right treatment, right?
Of course.
So I'd say maybe yes to you to have PRP, but maybe no to another patient who was a smoker and wasn't sleeping well and had led a really unhealthy lifestyle.
Yeah.
So it depends. And I would advise you instead of having maybe polynucleotides or growth factors. So those are traditionally the treatments that are available to patients. Apart from that, they can go off and have a surgical transplant. But even prior to having a surgical transplant, you'll know this as well because we have one of our team members in clinic whose other half is going to have a hair transplant, who's on a course of PRP. Actually, we've got two. One who's had a hair transplant, one's about to have a hair transplant. They always have PRP before and after. And the reason why is because you're fertilizing the scalp. You're literally infusing the scalp with all of the good nutritional elements to improve healing and hair growth. So when you go to have the transplant, it's more likely to be effective and it's more likely to take. Because even when you have a hair transplant, not all of them are going to stay. You're going to lose some of the hair.
Yeah, no, that's true. I suppose you want to do everything in your power. And a lot of our patients come to us for the non-surgical options before they go down that surgical route, as we see with dermal fillers. Patients come to us maybe for non-surgical rhinoplasty before they consider a surgical route, if that's something that works for them. So
absolutely. Although we have patients who've come after having surgery and they want to maintain. So it's a great maintenance treatment as well.
Definitely.
And I think when it comes to maintenance of a hair transplant, PRP is certainly one that I'd be very comfortable with having because it's autologous, which means we're taking it from you. We're not just taking it from fish, and we know that it's your blood. So it's not going to be, there's the risk profile is very low then. Yeah.
Would you say the same for the hydrofacial care revive for good maintenance of healthy hair essentially?
Absolutely. Scalp health is your first thing.
Yeah.
It's the first thing you do. It's like with the skin. I say to my patients, if you're not going to wear an SPF, there is literally no point in doing anything else. So your bare bones basics is brushing your teeth in the morning, changing your underwear, washing your face, and putting SPF on.
Yeah.
The bare bones basics when it comes to hair treatments is diagnosis, ensuring scalp health, using the right things at home before investing in treatment. If you're not using the right shampoo, you're not cleansing your scalp, then what's the point in investing in all these treatments?
Definitely.
And then also remember maintenance. And I think one of the most effective treatments for maintenance is PRP.
PRP. Okay. Is there a way to prevent hair loss?
Not really.
No, okay.
We don't obviously know when a patient is going to have hair loss. Some patients you might even start getting telogen effluvium after a stressful life event. People go through it after death in the family, a divorce, even a high temperature. You can't control all of these variables. So I wouldn't get too obsessed or bogged down in trying to do that. Of course, healthy habits are important.
Yeah.
In the same way that you want to brush your teeth and floss the teeth you want to keep. Use the right shampoos on your scalp. Don't put too much tension when you've got your hairstyles. You talked about your boyfriend your husband now, husband wearing a hat. You don't want to put too much pressure because you can get alopecia, traction alopecia, which is caused by pulling at the roots, weakens the roots. So if you've got tight hairstyles, that's not a good idea either. Okay. So all of these little things are healthy habits that will help to prevent hair loss. I never tie my daughter's hair tight or my hair tight. These are preventative things, using the right shampoo, using the right conditioner. Okay. I'm not overstyling your hair, but actually we do know that drying your hair or your scalp after a shower with a low heat is actually better than allowing it to air dry. So instead of just leaving your scalp to air dry after a bath or after a shower, just use light heat setting and dry your scalp.
Okay, that's really interesting.
To reduce inflammation.
You almost hear that using anything, any
excess
on your hair.
Heat. It's all about excess heat.
Yeah.
So excess heat will damage your hair.
Okay.
When we're talking about scalp health, a low heat setting to dry your scalp is better.
Oh, very interesting. And so when would you say to start considering treatments? At what point, maybe within a hair loss journey, would you say now is the time to consider something?
As soon as possible.
ASAP.
As soon as possible when it comes to hair loss, because of the risk of scarring.
Okay.
And once you have scarring, it's not like acne scarring, we can treat it.
No.
Once you have a scarring in your follicular orifice, it does render treatments useless, really. Unless it is post-pregnancy and it is a normal physiological process, or unless you have anagen effluvium, which is a condition of hair loss because you're no longer growing hair, which can happen after chemotherapy for cancer. That's a given. You know that that's going to happen because of the physiological state that you're in. If you don't have hair regrowth after a certain period of time, or if it's not self-limiting or doesn't resolve after a few months, then I wouldn't wait years, that's for sure. Yeah. Do not wait years.
So it's the same with anything, isn't it? If you feel unwell, you will go to the GP straight away to treat your hair and your scalp.
You would hope so. But
you would hope so. You would hope so. That would be the aim. That's what we would encourage patients, or, we encourage patients as soon as, if they're having a breakout.
Yeah.
To get in contact with us, whatever it may be.
There are certain conditions like acne, particularly cystic acne. You don't want to wait. Anything that has the potential to cause scarring. And I think the take-home message is with hair loss, it can result in scarring. Yeah. There are two main categories, non-scarring and scarring alopecia. Non-scarring alopecia can result in scarring. Yeah. And male pattern baldness, female pattern baldness, also known as androgenetic alopecia, diffuse thinning of the hair. Yeah. If you start to notice that, know that can progress onto baldness. It can, and it does. Yeah. So get treatment as soon as possible, and diagnosis comes first. And when the trichotest is one of the diagnoses, but also if you have an underlying deficiency, then that is going to impact it. This is about holistic health. Yeah. If you're vitamin D deficient, which many, many patients are, by the way. I'd say at a minimum of 50% of the population in the UK is vitamin D deficient. You need to replace that. If you're iron deficient, you need to treat that. Those are the main things. Iron deficiency anemia is a huge one. Get your iron checked and be on iron supplements if you need it. Vitamin D, same thing. Biotin, there is absolutely no scientific data to suggest that biotin capsules, gummies, vitamins are helpful for hair loss. Okay. So it is a marketing ploy. Yeah. It is something that has been pushed in the marketing space. Yeah. And people are taking biotin gummies all the time, even when they don't need them, and they can result in acne breakouts. So don't, that is not money well spent. No. Do take a general multivitamin. Absolutely do. Yeah. Do take your vitamin D if you're deficient. Do take your iron if you're iron deficient. Do take your vitamin Bs if you're deficient. Okay. So have a blood test and check all of these things and check for any underlying deficiencies. And also if you have a family history of hair loss or family history of hypothyroidism, that there's a huge genetic link there. Okay. So if your mom, your dad had hypothyroidism, you're starting to notice that you're fatigued, you're maybe gaining weight, you're losing hair, you've got other systemic body signs, then you need to get that sorted first. Okay. Hair loss usually has a trigger. So get the trigger sorted. It's not just about infusing your skin with all these fertilizers, but also treating the problem at the source.
Treat the source first. Perfect. Thank you so much for sharing all that with us.
My absolute pleasure. Thank you for coming.
No problem.